Welcome to part 3 and the final installment of Matching the Pill to the Pain, a brief pain medication review blog series. I am Dr. Kent, your narrator from chronicpain.com. Part 1 was an introduction to pain medicines and how we use pain medicines. Part 2, we moved on to analgesic medications, focusing on non-steroidal inflammatory drugs and opiates. Part 3 is going to be mainly over adjunctive medicines. Let's review what adjunctive medicines are. These are add-on medicines that increase the first treatment's efficacy or enhance its effects. These are the helpers, the add-ons that make things better. The antidepressant medication class is a major adjunctive medicine class in pain management. Antidepressants are effective in pain therapy and commonly used for chronic pain, especially when part of the problem includes associated insomnia or mood symptoms. Now, some antidepressants have been approved by the FDA, which is also known as the Food and Drug Administration, for types of chronic pain. An example would be Cymbalta. A lot of others haven't been approved, but they've been used for many, many years for pain syndromes like diabetic neuropathy pain, nerve pain associated with shingles, postherpetic neuralgia, fibromyalgia, neuralgia, low back pain, migraine, and more. The pain-killing mechanism of these drugs is not fully understood. Antidepressants appear to change nerve cell activity in the spinal cord and the brainstem, inhibiting or reducing pain signals, but they don't work immediately, and we don't totally understand what they do. Different antidepressants work differently. They're different chemicals, they're involved with different receptors. You may feel some relief from antidepressants after a week or so, but maximum relief usually takes a month or more. Now, pain relief from antidepressants generally is moderate. Antidepressants also will help improve sleep, change sleep architecture, help mood and fatigue, as well as energy levels. Antidepressants are classified based on their chemical structure or how they work. One of the most effective groups of antidepressants for chronic pain is known as the tricyclics. Some of the tricyclics include amitriptyline, imipramine, and nortriptyline. Another group that helps pain is the serotonin and norepinephrine reuptake inhibitors, which is also known as the SNRIs. These drugs are like Cymbalta, which has been shown to be effective for chronic pain. In fact, is approved by the FDA for many uses in different kinds of chronic pain. The side effects of antidepressants can be problematic. You need to be aware of them because there are a lot of these side effects of the antidepressants are also common side effects of other common meds used in pain management. Side effects can add up on you, so be cautious with them. To reduce or prevent side effects, your doctor will likely start you on a very low dose and slowly increase the amount, trying to keep you at the lowest effective dose and the least amount of side effects. Many people are able to take antidepressants for pain, particularly because the dosages can stay pretty low. They're not usually near the dosages they're used in mental health. Also, the newer medicines tend to have fewer side effects. Now onto another group, the anticonvulsants or the anti-seizure medicines, which were originally developed for epilepsy and often still used there, but been found very useful for chronic pain, especially nerve pain. Carbamazepine, oxcarbazepine, gabapentin, pregabalin, topiramate, lamictal. These are all different kinds of seizure medicines that are now used for pain. This class is very effective for nerve pain, neuropathy, trigeminal neuralgia. Now, we don't know exactly how they work in chronic pain. They may block the flow of pain signals from the central nervous system, or they may block abnormal excitation in the peripheral nervous system, or they may do other things, but they may do multiple things, but they all work differently, and they all affect different pathways. Some of them are sodium channel blockers, some of them are GABA blockers, some of them affect glutamate. They affect different things, so they work differently. Now that makes sense because we see them do different things well. For example, topiramate tends to be very good at helping migraine prevention, but not as good at neuropathy and nerve pain. Pregabalin seems to help with disorders that have to do with the nervous system, like fibromyalgia or neuropathy and shingles. Gabapentin seems to help with nerve pain, nerve root pain, spinal cord pain, and shingles pain, and post-shingles nerve pain. Carbamazepine and its newer version, oxcarbazepine, are very good for trigeminal neuralgia, which is a sudden, severe facial pain. Now, this class of med has side effects too. Some of the common ones are dizziness, drowsiness, fatigue, so you need to be monitored closely by your physician. We just have a little bit of time, so let's review one of the great topicals, the lidoderm or the lidocaine patch. When it came out, just a great safe medicine for shingles patients and postherpetic patients. Very, very helpful. It, by itself or in combination with Neurontin and Lyrica, made a big difference in this kind of pain population. Now, some quick stuff worth mentioning. I'd like to say a few things about tramadol, released first under the brand name Ultra. It comes in long-acting and short-acting versions. Many people consider it not to be a narcotic and not to be addictive, but that's not really quite the case. It hits the same receptors and has similar problems with abuse and addiction, just like other narcotics. It is considered an analgesic. We did speak a great deal about all the great new rheumatological medicines that have come out in the last decade. There has been a revolution in immunological and rheumatological drugs. These drugs are quite complex, and we didn't have time to go over them. These immunomodulators help a great deal with disorders like rheumatoid arthritis. We didn't have time to review them, but I hope to go over them in our webinars, and their medicines like Humor and Enbrel have made a real big difference in a lot of people's lives, and these injectables are great. Let's also talk about another revolution, the medication marketing revolution. It's crazy, all the commercials, etc. But I briefly want to discuss the so-called revolution in the over-the-counter medicines. We now have buffered, enteric-coated, time-release, sustained-release, extra-strength, gel caps, gum, liquid. But the truth of the data shows that there's not much major difference between all these types of vehicles for medicines. It's mainly hype and marketing. The choice is really between the different type of medicine and not the hype. What works for you and what you tolerate is what you should take. Don't believe all the different marketing tools. Now, there are many different medicines we didn't get a review. We don't have time to discuss things like the combination classes, which can be dangerous and cause rebound pain and headache, steroids, which are used for injections, and epidurals, facet injections that reduce inflammation and can be taken orally and have a lot of side effects if you use them long term, bupivacaine and other local anesthetics, clonidine, and older blood pressure medicine used in pain. We just don't have time to review everything, but I think we hit the most important things for a brief review. A quick comment on pain management before we go. It's a process. It's a process that requires communication and for you to be active in that process. Active in the communication, active physically, active in your care. Being well informed. This will open up opportunities and paths for new care, better quality of life, and more relief from suffering and disability. Please be active. Please do the work, and you'll get relief. In conclusion, find what works for you. We're all different. Pain experience is different. Response to therapy is different. You need what works for you best. Take an active approach. Explore all the opportunities from physical therapy to meds to alternative methods. Find a good team. Communicate to them. Get the work done. Find relief. Thank you for the privilege of speaking to you. If you desire more in-depth information, come to our website, look at some more blogs, sign up for a roundtable, sign up for coaching or a webinar. We're new at this media. Love feedback. Don't hesitate to give your opinion. This is Dr. Kent signing off from mychronicpain.com. Take care. I hope today is a better day for you.